Well, there are really many, many touching moments in my professional career
Hmm.
as a geriatrics doctor. I think one particular moment comes to mind, Angela, when you asked this question. And I remember it was actually a winter morning when I was working in the hospital clinic. And then an older person came along with their children. And the older person have a long-standing health condition that made it difficult for them to express themselves in words. So they have difficulty
Hmm.
talking. And I remember I was actually doing the assessment in the clinic when all of a sudden I recognized the person, the older person, was trying to high five with me. So I thought, okay, I will high five back with the person. It was amazing because the person wouldn't stop high-fiving. And in fact, I learned that it was their way to express their gratitude, their happiness, because they couldn't speak in words.
Hmm.
And I was busy high-fiving with the person. The children basically said, "Oh, Dr. Wong, this is great. Could I actually take a picture of you high-fiving with their parents?" And so it was a very touching moment, and it made all of us realize that when we talk about human connection, that communication is not only by words, not only verbally, but a lot of non-verbal ways of expressing ourselves, such as in this particular person, their way of expressing their gratitude and their happiness was through the high five. So it was a very touching story, something that the person has granted us permission to reshare the story, which is why we're sharing now. And I think it's really important for us to learn from that experience. You know, as an educator, as a professor, that's a story that oftentimes I share with my students and my resident doctors.
Wow, wow, it's very moving. So as a healthcare professional, it's not only about to provide professional care, it also has that kind of personal touch, right? Connection to the residents or patients. That's just one step further, right?
Absolutely. And that
Yeah.
is so important because for all professionals who are
Mhm.
providing healthcare as a health professional, a medical professional, excellence in care is obviously very important. And that's what we learn and that's what we teach. But part of that excellence is having that compassion for other people whom we serve. And that would include those individuals who are more vulnerable because of certain health conditions that they might have. But we also need to be compassionate to ourselves as well. So I've always learned that the sense of compassion is so important.
Yeah, 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 yeah. I can feel compassion from your eyes. You are very you give people a kind of very sincere feeling, reliable feeling. I like to be your patient.
Well, thank you. I'm
Yeah.
very humbled and honored. I think we know that certainly in Canada, we have a lot of very diverse patients and communities whom we serve. And
Mhm.
one of the key things that I've learned from a long time ago is, you know, as a medical practitioner, as a healthcare provider, we have to work in teams.
Yeah.
And in developing these teams, and I have had the pleasure an opportunity to develop many teams around the country or across Canada over the years. But the key thing that we do is really try to influence and inspire others to serving the needs of people whom we need to serve. And that's not just about, you know, conferring knowledge and skills. They are very important. That's clearly part of that excellence of care. But it's also very much about sharing the heart piece, the motivation, why we do what we do. And this is particularly true in seniors for older adults, because we know that, you know, for older adults, oftentimes they may have different conditions that make them relatively voiceless. How do we help them to amplify their voices? We also have to remember that, for most older adults, the aging process is what we describe as healthy aging. And so, in fact, for each and every one of us, we are keenly interested in asking ourselves, how can we age in healthy ways? So healthy aging becomes something that, I've done a lot of work over the years to try to empower people to do. And interestingly, the 3 tips that I shared earlier on are the same tips that we can use for healthy aging, both for ourselves and for our loved ones. I think in addition to those tips, there's certain things that we just need to be mindful in terms of that healthy aging sense. At a community level, I think there can be programs that are developed to encourage healthy aging. I talk about group exercise program, group socialization programs, maybe happening in community centers in culturally sensitive ways. Remember that when we try to age, the things that we need to think about is not just about health, but about everything else. So the environment around us, so the infrastructure around us, for example, becomes really important. Transportation, for example, having food security, for example, having a place to stay at, so home situation becomes really important. It is very timely for us to talk about aging and healthy aging because this decade right now has been declared by the World Health Organization, the WHO, as the decade for healthy aging. We are right, in the middle of this decade. And so I think all of us in Canada and globally will need to really be mindful in terms of what can each of us do that will contribute to healthy aging. And then as a society, what can society do to contribute to healthy aging?
Yeah, wow, it's very empowering.